Frequently, as a speech-language pathologist, I do evaluations of children, and I'm asked, why is it important to have a diagnosis for my child with autism? One of the things that I can speak to is the fact that often parents will take their child to the pediatrician for frequent well-child checks, and the parent will say to the doctor, there's something wrong, but I'm not sure what. The doctor will ask, well, what seems to be the problem? And parents have difficulty formulating what the problem is. There's something wrong with my baby. They don't act like other babies. My baby isn't making any sound yet. And so they immediately have their hearing checked and they find that their hearing is fine. And they go back again, and frequently these visits end up in tears, where the mother says, I know there's something wrong with my baby, but nobody will help me. Those parents end up in my office for an evaluation. And we start by identifying what are the cardinal signs that they're seeing, what are the symptoms, the problems, looking at the typical things with joint attention. Are they talking? Have they made any sounds yet? Do they interact with other children as siblings? How do they respond to their parents? But what's the bottom line is that it's so important for families to have a diagnosis early on, first of all, so that they can access services and resources for that child, but also so that they have an idea of what their future is. They can resource information on the net. They can talk to other professionals. They can talk to other parents, join support groups, and really connect within their own community for accessing services for themselves and their child. Because while the child has autism, the entire family has a child with autism. And that is a very heavy responsibility for anybody to deal with. That's part of the reason why it's so important to get a child in early on, especially for a speech-language eval, because as part of the team, speech-language pathologists are often the ones who start out identifying those children as being in need of further assessment and services. Most states allow for speech-language pathologists to make the diagnosis of autism which is consistent with the American Speech-Language Hearing Association's policy. However, some states do not allow that, and so if you're in a state where you're not allowed to make that diagnosis, it's urgent that you contact the pediatrician as a speech-language pathologist and share with them the information about what are the cardinal signs of autism, what kinds of services can you provide, who else needs to be involved, because oftentimes those pediatricians are dealing with such a wide range of issues that they may not be aware, and once you contact them, I've never had a pediatrician not respond.